Depression, anxiety, drug addiction, bipolar disorder, post-traumatic stress disorder. These and disorders like these are becoming an upcoming crisis more than ever. Mental health issues affect more than 1 in 5 US adults, or more than 20%. Everybody in their life has met individuals who struggle with mental health, but for many of us, mental illness is a personal and perseverant struggle as we guide family members, friends, and ourselves through it. Today, using research from the College of Western Idaho Library, I will be giving persuasive evidence that mental health care should be more accessible. I will be telling you about mental health rates, problems with accessibility, and the benefits of proper mental health care. First, I'll be talking to you about mental health rates. To understand why expanding access to mental health care is so important, we first need to talk about the rates of mental illness today, especially among our youth. In a 2022 BMC Public Health article, researchers found that between 2011 and 2022, persistent feelings of sadness and hopelessness, along with suicidal thoughts and behaviors, increased by 40% among youth. This isn't just a statistic, it shows a real decline in the emotional well-being of an entire generation. And these numbers only worsened during the COVID-19 pandemic. According to the same article, the COVID-19 pandemic has exacerbated these results greatly, accelerating the rise in depression, anxiety, and overall psychological problems. When young people face mental health struggles at this rate, it shows that our current system is not meeting their needs. Secondly, I'll be talking about problems with accessibility. Another major reason mental health care needs to be more accessible is the sheer number of barriers people face when trying to get help. For many, affordability is the first obstacle. Mental health visits can range from being a copay that you pay off over time to hundreds of dollars per session that you're required to pay in the appointment. And for a lot of people, including myself, my brothers, and people I know, these costs can quickly become a reason to delay treatment or stop going altogether, even when the need is real. But even if somebody can afford care, the system still works against them currently. Waitlists for therapists can stretch for weeks or months, leaving people stuck without support during the exact times they need them. For rural communities, the situation is even more complicated. In a 2023 Higher Education Journal article, we learned that rural individuals face unique challenges when attempting to receive treatment for serious mental illness and mental health care. Stigma, a lack of privacy when seeking treatment, a shortage of mental health workforce professionals, a lack of culturally competent care, affordability, and transportation are all factors that complicate the need for treatment. When both cost and access stand in the way, it becomes clear that the system isn't designed for the people who need it and the people who rely on it. Another reason why expanding mental health care access isn't just important, but extremely necessary. Third, I'll be talking about the benefits of proper mental health care. Improving access to mental health care isn't just about preventing crises, it's about promoting healthier lives and improving individuals' quality of life. Mental health and physical health are deeply connected. When someone is struggling mentally, it can often show up through their physical traits, including chronic stress, poor sleep, and even a weakened immune system, which I've seen firsthand in both family members and myself. That's why proper mental health care can make such a measurable difference in one's overall well-being. One major component of treatment that's often overlooked is physical activity. Exercise is frequently used as part of treatment plans because it releases endorphins, reduces stress hormones, and significantly improves one's mood. It also plays a role in building positive self-esteem, giving people a sense of accomplishment and control. A 2024 article titled "Physical Activity and Mental Health," published by the International Journal of Behavioral Nutrition and Physical Activity, explains that physical activity will have greater impacts on population mental health. When people have access to proper mental health support, including therapy, resources, and lifestyle-based support, they're able to improve both their emotional and physical health. And accessible mental health care doesn't just help individuals survive, it helps them thrive and helps their overall health. Depression, anxiety, drug addiction, bipolar, post-traumatic stress disorder. These are all mental health issues that we see and experience day to day, but they can also all be helped by improving mental health care standards. Today, I've told you about mental health rates, problems with accessibility, and benefits of proper mental health care. So, as we've seen, the mental health care crisis is growing, and we need to push for affordable mental health care in our schools and communities. My call to action is simple: for campuses and schools to provide more mental health support, and for costs of mental health care to go down. As actress and mental health advocate Glenn Close once said, "What mental health needs is for more sunlight, more candor, and more unashamed conversation." As we continue to push for affordable care and demand better mental health support, then we can help create that sunlight.